Okay, so I've got Tom Butcher here. He's the sales director of Medigold Health, and these guys have been quite a big presence here this week. So, hi Tom, welcome.
Hi Ben, nice to meet you.
Nice to meet you. Having a good show so far?
Yeah. Probably I've been here for a decade, I would say, or we've been coming for a decade. I think we've been probably here for that time each year. As Medigold, always prominent position,
Yeah.
great event for recruitment, catching up with contacts old and new, and lots of interesting partnership conversations as well. Speaking slots, it's a good event.
Yeah. And have you found it this year? You found it? Is there plenty of people about?
Yeah, I think it's. I think the footfall's a little lower, but the people we've met are highly relevant. I think what we're seeing is a kind of consolidation of talent.
Yeah.
Yes.
Quality over quantity.
Yeah, absolutely. So people
Yeah.
start the course, good brands, knowledgeable people that can provide something really meaningful, whether it's equipment or expertise or nationwide provision like we do. Yeah, really strong.
Yeah.
Strong brands. So
Quite a nice blend between internal practitioners, clinicians, and providers. I've found in terms of conversations we've been.
Yeah, it's a great opportunity to talk about specific disciplines in an industry which is really broad. You know, health is anything it can possibly mean to each individual, and we've got probably somebody at this event that can talk to you about every facet of health.
Yeah. Okay, and so, and what are you particularly here? Have you come with a kind of a message or some insights that you're talking to people about this week?
So Medigold Health are a workplace health brand. We try and make a really broad offering for organisations that are looking to do something with workplace health. It could be managing sickness absence and helping with productivity. It could be managing statutory compliance and helping with their obligations as an employer or their regulations and the work they do in a particular industry. Or it could be broad spectrum health and well-being, which can mean a huge number of things. Sort of mental, emotional, physical, financial, social, all of these things. And like I say, we've got providers that can touch on all of that, and we partner with a lot of them. We do a lot of the work ourselves also.
Yeah, so I mean, so I've worked in this space. So I used to run a health and wellbeing business from a business psychology perspective and helping with strategies, measurement, all that kind of stuff. So the one thing that I took away from all my time, 20 years doing that, is that there's so many different starting points for organisations. There's no two organisations are the same. So this idea of being able to start where they start, I guess, that's part of your sounded like that was part of your.
It is. That's a really correct, really relevant statement. We find that large organisations are typically looking to iterate. So, the data says that majority of them, maybe 90%, have got something in place already when it comes to occupational health. And occupational health can mean a lot of different things to a lot of different people. But generally having something is better than nothing, right?
Yeah. But that something could be different.
Yeah, and their starting point is different. And they might need better data, they might need better provision and better coverage, they might lack certain specialisms and therefore come to us to source them. I think where we see the biggest need is smaller and medium-sized businesses that have typically not engaged as much. I think, again, the data suggests that something like 20-25% claim to have access to occupational health, which leaves a significant number that don't. And in terms of actual volumes, we're talking about best part 1.5 million businesses, micro businesses, small businesses, medium businesses that fulfill that kind of small business bracket.
And what are the blockers for those organisations that are still on the starting blocks with it? Is it money, or is it time, or is it knowledge? What do you typically find is the blocker that you're trying to unblock, I guess, for what the better word?
I think knowledge. So we've found that when the case is made, and all too often they come to us too late. They need to fix an issue. They're willing to pay for it. They're able to pay for that. I don't think the money is an issue. I think it's more the awareness that these private services exist for small businesses, and that they can be quite intrinsic to the good operation of a business, even a small one. And particularly, it's quite acute if you have a 20-man business and you lose one individual for a long period of time for a health-related absence. it can, depending on that position, it can have a huge impact.
So sometimes are they realizing that they perhaps need some help there because they've been reactive,
Yeah.
waited until something's happened, and then it's like, right, we should have been ahead of this.
The problem with our industry is it's been geared up for the large organisations that have sustained it for 2 decades. So it needs to pivot towards these circa 75% of small businesses. I can't do the maths now, but it's got to be close to 1 million organisations that don't have anything.
Yeah.
And all of that plays into the sickness absence challenge in the UK. It helps push employees that are wavering or struggling to stay in work or to get back into work. It just helps to push them back over the line with some useful advice, access to treatment.
It's part of the productivity crisis as well, isn't it?
It is, absolutely. And these services are here. I mean, our industry's got an issue with the scale at which it does things. And so I'd encourage small businesses to be open-minded and to talk to providers about ways that they can help. We need to know what these businesses do and what their obligations are. And then we can design something that fits. It's a real specialism what we do. We have doctors and specialist practitioners who are among a handful in the country. And if you work in a sector like aviation or maritime or renewables or nuclear, then there are only very few people that can help you when it comes to managing the health and well-being of particular staff members.
Okay.
So you really need dialogue. You can't react and come and pick up the phone and try and find a provider that will help, because you'll just be disappointed.
Yeah. Okay. So it's about having that stuff in place. And I guess if there is a bit of it would suggest, given the numbers that don't have anything in place, that there is a bit of an access problem for smaller businesses. What are you guys doing to try and change that, to open that up and, obviously drive awareness, but also once they are aware, how do they get going with it, and how do you give them that access?
I think it's a marketing issue, because if you look at the medical insurance industry, which has had no shortages of cash behind it, it's ubiquitous, and a lot of these small organisations don't have proper clinical coverage, but they do have a medical insurance policy of some sort. Increasingly unsustainable. They're becoming very expensive now. So I think our message really is to just start thinking at a very early stage when you become an employer. So you've got 3 people, 4 people, 10 people, 20 people. You're now responsible for those people. And whether it's managing the sort of ongoing productivity and the sickness absence, which from a business owner's perspective is a smart thing to do, managing the compliance, the obligations, which is the necessary thing to do. We're required to do it. And then providing health and wellbeing benefits, which is the right thing to do. People are looking for that in employment packages, and as a small business, you want to be taking top talent. Otherwise, you're going to struggle to break through, and you have to align with the expectations of those particular employees. And they want to have private GP services. They want to have access to emotional health support when they need it, and these are expectations now.
So there's something there. It's like being more intentional about how you think about insurance, I guess, because I think a lot of small business owners, they get insurance because that's what you do. So it's like, well, we don't want to get in trouble, so we better get insurance. They're not really thinking about what that insurance is driving in terms of outcomes. A defensive move rather than a kind of constructive move.
Well, this is it. And so in providing private clinical services to organisations, these are more relevant. We feel it supports the running of the organisation, and what we do in occupational health is focused on delivering outcomes for the organisation as well as for the employee. Medical insurance is exclusively employee focused. It's still a great benefit, but I don't think that occupational health should be an afterthought. And this is I think part of our emphasis to small employers, but also the government. They could spend very little money, make a very big impact in the UK by simply making people aware that they can purchase private clinical services, occupational health services, at a very early stage in their business life cycle.
Incentivizing that.
Rather than waiting for it to become an issue, and for us to help to dig them out of that particular case, whether it's a grievance or a tribunal or a capacity issue of somebody who's really struggled and has been unable to work for years, and we can intervene earlier, and we can help people stay in work. And this is the mood music at the moment in the UK, isn't it? Is making sure that people are able to do the jobs that they're needed to do and to make adjustments and be preventative. Absolutely. And I think occupational health has probably got a PR job to do in that aspect. So we could do with some help from the government, I think.
Yeah, I think so. And I suppose another constituency that can help them is, you mentioned earlier about employee expectations. So, if you like, the customer voice is a lot. I've had quite a few conversations where that how employee expectations have changed post COVID has come up during the podcast this week. I guess is that that's about demand, isn't it? So if employees are becoming, let's say, more bothered than they about having that occupational health support than they are about just focusing on pay, for example. If it's as important, it's probably going to be more important, but it's as important, then that's a market shift, right? And is that something you're seeing in your the clients, the employees in the clients that you work with?
So we find that there are two categories of small employers: the ones that know they need to do something, and then the ones that are maybe more begrudging, and are a little bit more reactive to a request. A typical example is a request from a partner of theirs that they have particular medicals done. We can help them anticipate all of that. All they have to do is talk to us. So our support products for smaller businesses don't just include the actual services. They include a lot of consultancy on their industry, what their peers are doing, how to preempt some of the requirements.
So it's like a partnership.
Yeah, absolutely. We are a consultancy. We're very much like a legal services firm. We have professionals. We help people to understand what it is they're going to need, how to avoid risk, how to take opportunities, and create something which is a sustainable way to manage health in their industry and their organisation. Much more than just transactions.
Okay. That makes a lot of sense. And what have you just kind of thinking away of kind of rounding off, what have you picked up from any either talks that you've seen or people coming and talking on your stand this week? Because obviously I've been past it, it's been pretty busy this week, which is obviously great news. But what kind of themes are you picking up from the employers that are talking to you?
So I think people are quite clear on what they need now. One thing we thought, I don't want to talk about the pandemic, is somebody told me to shut up about it recently. It's 5 years on now.
It is still relevant.
But no, it's got a real ripple effect in that it galvanized employers to look into employee health and work out what it is they need. And we've actually seen probably a slightly lesser emphasis on well-being bells and whistles, and a harder emphasis on core clinical services. So helping people who are really unwell, making adjustments so that they can continue to work even with chronic illnesses.
Which connects to all things like presenteeism.
Yes.
So hits the bottom line.
That was so acute. I mean, what people needed during those 2-3 years that we worked through in the pandemic was real clinical advice and guidance on real conditions that were affecting them then, rather than preventive work has its place, but I think what they found is they were missing that clinical coverage that occupational health provides. So we're having lots of really meaningful conversations about managing staff absence, managing sickness absence, chronic conditions. Neurodiversity is a really popular theme, and we're seeing a lot of complex conditions, so multifaceted, including neurodiversity, whereas previously it wouldn't have got such wide acknowledgement. It's now popping up in a lot of our everyday cases, and so employers want to understand what that means, how that affects the reporting.
And typically, I do think that is an area where employers know they need to do something, but don't quite know what to do.
And it's great that it's got more recognition and people are more in tune with it. But for employers, it poses complex problems that are practical and clinical, and they need working out and can't be solved with sort of preventative initiatives. It needs real professional guidance.
Which is back to knowing working out where to start, isn't it? In terms of if you're going to start to offer services and support about neurodiversity, there's a range of different approaches you could take to that. So you need a proper conversation and some help from people who can give you some insights and some options on that.
Yeah. So my message, I think, in summary, would be small organisations should start thinking about employee health very, very early. At the same time, they're working out how they keep the lights on.
Yeah.
You know, what sort of fleet to purchase for their organisation. If they need a fleet, then they probably need occupational health as well, because they've got a handful of people that they're responsible for.
Yeah. Okay, that's brilliant. And what good way to finish. Well, listen, thank you so much for the conversation today. I really enjoyed it, and enjoy the rest of the show.
Thanks, Ben. Pleasure.
Cheers.